So following reports of lead poisoning cases in 2 counties, Oregon Health Authority is urging parents and caregivers to avoid using a baby food that has been recalled by the U.S. Food and Drug Administration. 2 counties of elevated blood lead levels in babies were detected in counties with Target stores. During interviews with the families, investigators determined the children consumed the flavor affected by the recall. The cases followed a recall alert in March of more than 25,000 packages for a Good & Gather baby food called pea, zucchini, kale, and thyme vegetable puree. The product was sold in 4-ounce tubs. Good & Gather is a Target store brand, and the product was sold nationwide at the company's stores. While the FDA recall event is considered terminated, the product has a best use date of December 2025. This means that some families might still have the product in their homes. So last year, Oregon had 361 children with blood lead levels that exceeded the blood lead reference value, of which 237 cases were children younger than 6. That amounts to about 1% of children tested for lead. The most common sources of lead exposure for children are ingestion of paint and dust containing lead. However, exposures from traditional cosmetics, glazed pottery, fishing gear, bullets, antiques, and informally imported spices have also been identified. While lead is toxic for all people regardless of age, small children are especially at risk because they're still growing and developing. Continued exposure over time can permanently damage their central nervous system and may result in long-term health problems such as learning disorders, impaired speech and hearing, and brain damage. Even small amounts of lead may affect behavior, cognitive development, and academic achievement, according to the American Academy of Pediatrics. So signs of lead poisoning are not always easy to see and can be mistaken for other illnesses. Without a blood test, lead poisoning may go undiagnosed, especially since affected children often don't look or act sick. Possible signs of lead exposure and symptoms in children include tiredness or loss of energy, hyperactivity, reduced attention span, irritability or crankiness, poor appetite, weight loss, trouble sleeping, and constipation. For more information, you can visit the CDC's Childhood Lead Poisoning Prevention Program website or the Oregon Health Authority's lead program website at healthoregon.org/lead.